Hey everyone, how are we doing? In today's video, let's look at different options that someone might have if they've got no bone for traditional kinds of implants. Okay, and we're specifically talking about in the top jaw. It's less of a problem in the lower jaw because of the way that the bone is lost when teeth are removed. So to help explain what's going on, I've got a couple of my friends. Okay, we've got a normal healthy skull with all of its teeth here, and then we've got a couple of models here which are essentially practice models which I've taken from courses that I've been on over the years, but they help demonstrate where these other kinds of implants go. Now, let's say you're in a situation where you don't have enough bone. You've been to see a couple of dentists who do all-on-4 or whatever it is. They've taken CT scans, they look at the scan and there's nothing there. Or very little. Remember, our thinnest implants are usually about 3.5 millimeters in width, and if we want a millimeter of bone all the way around these, we're looking at 5.5 millimeters of thickness of bone. In a lot of cases, some people will only have 2 millimeters of available bone, which means we need to look at something else. So the options in these situations are we can either do treatments to rebuild the bone, and I'm talking about different kinds of bone grafting, the most extreme of which is taking bone from outside the mouth, so maybe the hip or the rib or something like that, and fixating it inside the jaw. Obviously, this is something which is done in hospitals. It used to be done much more, but these days there are other options which a lot of people prefer. Now, another way to rebuild bone is looking at something called sinus lifts. Okay, so we're going to touch on where sinuses are and look at this model. This model shows where a sinus is very nicely, but we can fill the sinus up with a kind of a bone substitute material, and over time your own bone will grow into there, again increasing the amount of bone, giving you more options to have implants. But this video isn't really about those kind of solutions. I'm not going to talk about ways that we can rebuild bone, because there's 3 types of implants that we can look at which engage in different bone. Okay, so that's the key difference here. The size of these implants is different as well, but that's not a big thing. It's just manufactured to a different size for this scenario. We have a situation where we don't have much bone. So if we let's compare a couple of these skulls. Okay, if we compare these two skulls, what you can see is on one of them, the healthy skull, the teeth are there, and if you imagine 2 times the height of the tooth, that's how much bone there is encasing the root of this tooth. If we look at the skull on the other side, you can see that all of that bone is essentially gone. And you can take a measurement from the base of the nose to the height of the bone, and it's much less on this skull, which has lost all its bone. So this means we can't use that bone to engage an implant. We have to look in different solutions, and the first of the 3 I'm going to show you is what is essentially on this model here, and this is called a zygomatic implant. The reason it's called a zygomatic implant is because it engages in the zygomatic bone. So this bone is, you can feel it on yourself, it's your cheekbone, and it's very good quality bone. And what you can see is on this model, the implant heads come out roughly where they would if you had a traditional all-on-4 kind of treatment. So when we do a full set of teeth on any standard implants, we want implant heads coming out as far forward as possible, so usually not the central incisor but the lateral incisor I like to go for, and then tooth number 5. Okay, so this gives us a good distance front to back. We call this the AP spread, the anterior posterior spread of implants, and that's important in helping to spread the load. So you can see that these 2 implants coming out in a pretty good position. Okay, we don't go all the way back I'll explain why in one of the later implants which we got in this video, but the implant heads come out in the right place. What is different about this is where they engage. So you can see that they come out of the bone again here, and whether they come out of the bone or they don't, that's you can do it both ways. And they go into this zygomatic bone here. This is quite a complicated treatment, and what it lets us do is use good quality bone here and have the implant heads coming out in the right place and fix a good quality set of fixed teeth onto these implants. Now, you can either have one implant or you can have two implants here. So if someone has two zygomatic implants on either side, we call it a quad zygoma case. Sometimes people have enough bone at the front and only need one zygomatic implant each side. So again, what it does, it just opens up our options in ways to rebuild a full smile or give someone a full fixed set of teeth in as little trauma as possible. Okay, so remember, this is a traumatic treatment. Okay, when I say traumatic, aftercare, even if you have standard implants, you're going to get bruising, swelling, possibly bleeding, pain, discomfort, all of this kind of stuff. It usually lasts about a week or so. And with this treatment, it's no different. But if we look at the other option where we first do our bone grafting and we let that all heal, you've got the trauma at the bone grafting stage, and then we're doing a similar thing when we're putting our implants in, and we may need multiple bone grafts as well. So all of these are invasive treatments and they involve aftercare. It's not like you have a longer implant and it's longer aftercare. Okay, I can show you photos of people who've had this kind of treatment done and the kind of bruising and swelling which is expected. Now, I can't show you guys, I show patients who come and see me because I don't have the permission to share those photos with you on YouTube. Now, this is just one way of engaging different bone. Another way is, and we're going to switch to this model here, which is essentially the same thing, but this model's got the eyes and this one doesn't. So this is just the midsection, the important section. And the really good thing about this one is we can see down the top. Okay, so here, this is a sinus, an air sinus. So you can see that I've practiced a zygomatic implant on here, and the way we do it is we find the sinus, we push this membrane, that's what the pink stuff is, out of the way, and then we engage the zygoma. Now, if we didn't want to do that, we've got another option, is actually put the implant in the same place. So it comes out of the mouth in the same place, but you can see there's a piece of bone which is separating our sinus from our nose. Okay, so this is our nasal cavity. And the bone on the outside surface, so outside from the middle we call lateral, and nasal wall, so it's the lateral nasal wall, we can push the membrane out of the way and engage in that bone. For this kind of implant, we need longer implants. That's the only difference. So a lot of the time I'll use Neodent implants, and the standard implants, if I'm doing a normal all-on-4, I might use an 11.5 or 13 millimeter implant, but here we're looking at 20-25 millimeter implants to engage that bone. It just means they've got to travel a bit more of a distance to get to their kind of final destination. So that's our second type of implant that we can use. And all of these are called extra maxillary implants because all of our maxillary bone, which is holding the teeth, has all gone. So we have to look at distant sites to help us engage our implants, because it's all about how tightly can they fit in the bone on day one. That's very, very important with all of these cases where we're rebuilding a smile essentially in one day. Now, our third implant is, again, it's extra maxillary, but it's slightly different because you can see it goes so far back. And this is called a pterigoid implant, and it scares a lot of implant dentists. Now, I'll tell you what it is and how it engages first, and then I'll tell you why it scares people. So you can see it's right at the back of the jaw. Right at the back of the upper jaw, and traditionally the bone up here is absolutely terrible. It's so soft you can't get that initial stability, that primary stability of the implant. You can almost push the implant through the bone. The bone is that soft at the top, at the back. But this implant is not actually engaging in that bone. You can see it goes a little bit further, okay, and here this is a junction between two different types of bones. And here where these little spikes are, these are called the pterigoid plates, and muscles attach into the pterigoid plates. This bone is much stronger. So This implant is often used so that we can extend how far our implants go back, again increasing our AP spread of implants, how far they are sort of front to back, and help reducing the load per implant. We rarely put teeth this far back, but it does allow us to put more teeth on a top set of implants. So some people will have a very wide smile, and if we are putting our further back implants in the position of the premolars, sometimes you can see that the very last tooth is missing. So in those situations, it's quite nice to place the pterygoid implants because it gives us the opportunity to go further back without compromising strength of the final set of teeth. Another advantage of these pterygoid implants is if we put our normal implants in, sometimes we just put in these pterygoid implants as a backup solution. If we're not 100% confident, we've always got the option of going into this more complicated site. Now, the reason a lot of dentists or implant dentists are a little bit scared of this kind of implant is that of the potential consequences or the complications that you can have, and these are significant. You see, if we go further up here, okay, so we're quite far away actually from where this implant should be, but we've got important arteries which go in here, okay, and they're quite big arteries. If these arteries were punctured, it's almost a life and death situation, okay, it is a very big deal. And we've got important nerves up here as well. So there are techniques to place these implants in safely. If you know your depths, if you've analyzed the CT scans in a lot of detail, then these are quite safe implants to place. But if you speak to some dentists, they'll say, okay, you know what, you've got an artery here, you've got an artery here, and they're all pretty close to where you want to put this implant in. But I think ultimately it depends on the skill and experience of the implant surgeon. So there are loads of people who are putting these implants in, day out, and with none of the significant complications, because there's really robust ways to avoid any of those. And if you're doing your implant treatment properly, you should never have those severe complications. So really, this is a safe implant in the right hands, but depending on who you speak to, if some dentists are not confident, they can say, oh, steer away from that implant, it's very dangerous. So I just want to give you both sides of the coin on that. So those are the three main options which we have when somebody comes to see me and they say, you know, they've been to a whole bunch of consultations and people have said that they've got no bone. These are the options that we typically look at to rebuild those kind of smiles. So I hope you found this useful. I hope you found it informative. If you did, you know, please give it a thumbs up. I've got a few more videos planned on this kind of subject. So if you do want to know more about this, you know, do hit the subscribe button. And I think there's a bell notification that you can click on, and that will help notify you when I do uploads. So that's it for today. I hope you found it useful. Until next time, guys, take care.